Assalamu alaikum. We are back with our third lecture on rheumatology and bone disease. Now, the topic is joints. So, according to this textbook, Davidson's Principles and Practice of Medicine, there are three main types of joint: fibrous joint, fibrocartilaginous joint, and synovial joint. Let me say it again so that you can memorize it easily. Fibrous, fibrocartilaginous, and synovial joint. Fibrous, fibrocartilaginous, and synovial joint. Next, fibrous and fibrocartilaginous joint. The symphysis pubis or pubic symphysis and intervertebral disc. These are examples of fibrocartilaginous joint. So pubic symphysis and intervertebral disc are examples of fibrocartilaginous joint. So the nucleus pulposus is the central part of intervertebral disc. Let me show you from Google. Intervertebral disc. The intervertebral disc here, if we look at this image, we'll get back. We'll just zoom it. So this is the intervertebral disc. This is the central area of the intervertebral disc. This is called nucleus pulposus. And the peripheral area is called annulus fibrosus. Okay, let's get back to our original page of the textbook. So the intervertebral disc and the symphysis pubis are examples of fibrocartilaginous joint. Fibrous joint. Examples of fibrous joint are skull sutures. Skull sutures we all know, but as I want to show you everything, let me show you these also so that you always feel confident. So these are several flat bones of the skull, and in between them, these are sutures. These are sutures. They have different names according to their location. These are sutures, and these are examples of fibro. These are examples of fibrous joint. Fibrous joint. This is a suture, this is a suture, and this is a suture. These are examples of fibrous joints. Then fibrocartilaginous joint, we already know two examples: the symphysis pubis and the intervertebral disc, and also the costochondral junctions. Costochondral junctions. That means the junctions between the ribs and their costal cartilages. Okay, costochondral junctions, and also the sacroiliac joints. We call them SI joints, the abbreviated form, sacroiliac joints. Let me show that also, sacroiliac joints. So we will go with the images. Let's see. So this is a sacroiliac joint between the sacrum and the ilium bone, sacroiliac joint. This is also the red marked area, is also sacroiliac joint, sacrum and ilium. The hip bone, sacrum and ilium. This is a sacroiliac joint, and this is an example of fibrocartilaginous joint. So we have learned four examples of fibrocartilaginous joint. Those are the previous two, the intervertebral disc and the symphysis pubis, and then the costochondral junction, and then the sacroiliac joint. Come again. Four examples of fibrocartilaginous joint. They are the symphysis pubis, the intervertebral disc, the sacroiliac joints, and the costochondral junctions. Then let's come to synovial joints. These are very large joint, and a range of movement is possible. Large range of movement is possible between them. Most limb joints are synovial joint, like shoulder joint, like elbow joint, like hip joint, like knee joint, etc., etc. All are synovial joint. Temporomandibular joint is an example of a synovial joint. Temporomandibular joint. Temporomandibular joint, it is a joint in your jaw. Let me show that also. So whenever you study anything, don't just read it and try to memorize it, but try to understand it first and then go for memorizing. Okay. So the temporomandibular joint, this is the temporal bone and this is the mandible, the lower jaw. And in between them, this joint is temporomandibular joint. This joint is marked here, labeled here. Okay, let me zoom it. So mandible, temporal bone. So the joint between them is the temporomandibular joint. This is an example of synovial joint. So let's get back. Synovial joints. So let's see an image of a synovial joint first. In a synovial joint, there is a cavity which is called synovial cavity. Synovial cavity, and there is a joint capsule outside covering the synovial joint. This is a joint capsule. Okay, and this is the synovial membrane. Synovial membrane. So these are articular cartilages between two long bones. So this is also inside the synovial joint. So this empty space is called the joint space, and here synovial fluid is there in the joint space, synovial fluid. So these are all about synovial joint. You have a joint capsule, you have synovial membrane, you have joint space, synovial fluid in there. So let's get back to the original text. Synovial joints. So the articular cartilage. This avascular tissue covers the bone ends in synovial joint. So we have seen that in the image. So what you have to remember about one feature of articular cartilage is these are avascular tissue. They have no separate blood vessel for their blood supply. Okay, these are avascular structures. Next, these are composed of type 2 collagen. Articular cartilage is composed of type 2 collagen. So you have to remember, when we studied about bones, we saw that bones are composed mainly of type 1 collagen. Okay, type 1 collagen. Here it is, type 1 collagen. So the most abundant protein of bone is type 1 collagen. And then when we are studying the articular cartilage, this is composed of mainly type 2 collagen. Okay. So these type 2 collagens stay in a hydrated gel-like structure. And that gel-like structure is composed of proteoglycan molecules. So proteoglycan gel. And there we will find type 2 collagen. So type 2 collagen suspended in proteoglycan gels. Proteoglycan is a broad term, and the most important proteoglycan is aggrecan. So the most important gel is aggrecan. The most important component of the gel is aggrecan. Again, aggrecan consists of a core protein to which several glycosaminoglycan side chains are attached. So let's look at the image. So these stick-like structures are type 2 collagen fibers. So these are suspended in a gel-like substance, which is composed of aggregants and which are composed of proteoglycans. And proteoglycans mainly is the aggregan, which has a core protein, and then various glycosaminoglycan side chains. So these are the side chains. These are the side chains. So again, the most abundant glycosaminoglycans, GAG, in aggregan are chondroitin sulfate and keratan sulfate. We'll go to the picture again. So keratan sulfate and chondroitin sulfate. The shorter ones are keratan sulfate. The comparatively longer ones are chondroitin sulfate. These are the glycosaminoglycans. Okay, these are the glycosaminoglycans. Let me label it here. So keratan sulfate, the shorter one, and chondroitin sulfate, the longer one. These are both examples of glycosaminoglycans. So let me label it here, GAG, glycosaminoglycans. Okay, these are examples of the glycosaminoglycans. So let's come again. Articular cartilage consists of type 2 collagens here. We will see the bundle of stick-like substances here. Okay, these are suspended in gel, which is called proteoglycan. The most important proteoglycan is aggrecan. These are aggregans. And aggregan consists of a core protein. This is the core, and with several side chains. The side chains are called glycosaminoglycan. Again, the glycosaminoglycan side chains are two types. Glycosaminoglycan side chains are two types. They are the shorter ones, the keratan sulfate, and the longer ones, the chondroitin sulfate. So this is the core protein labeled here. And this is the hyaluronan or hyaluronic acid here. This is another component of articular cartilage. So how do questions appear in exams? This may come as true false options. It will tell you that which of the following are components of articular cartilage. So these are the components. Anything outside this will not be a component of articular cartilage. So let's go to the text again. So hyaluronan is another important glycosaminoglycan that binds to aggrecan molecules to form very large complexes. So hyaluronan is another important glycosaminoglycan. So we have learned two important glycosaminoglycan. Um, One is the sulfates, the chondroitin sulfate, keratan sulfate, and the core protein, and then another is hyaluronan. So aggrecan has a strong negative charge. This is not important. Then these lines that I have highlighted already. With aging, the concentration of chondroitin sulfate decreases and that of keratan sulfate increases. So we have to remember that the longer side chains, the chondroitin sulfate, with aging, the concentration of that chondroitin sulfate decreases and concentration of keratan sulfate increases. And this results in reduced water content in the articular cartilage and reduced shock absorbing properties. Okay. These changes differ from those found in osteoarthritis. So what do we find in osteoarthritis? Where there is abnormal chondrocyte division, loss of proteoglycan from matrix, and an increase in water content. So in osteoarthritis, the proteoglycan matrix decreases, but the water concentration increases. So water increases in osteoarthritis, but with aging, normal aging process, the water decreases. So this is an interesting point because when we use common sense, we may think that in osteoarthritis the water content in the articular cartilage might decrease, but that's not true. That's not true. The water content increases paradoxically, I think. So we will have to remember that point. Water content increases during osteoarthritis, but during aging, water content or water concentration decreases. Okay, let's go to the next page. So we are clear about that image ultrastructure of articular cartilage. So cartilage matrix is constantly turning over, and in health there is a perfect balance between synthesis and degradation. Degradation of cartilage matrix is carried out by aggreganases. So these are some enzymes. We know that the matrix of the articular cartilage consists of mainly proteoglycans, and the main type of proteoglycan is aggrecan. So aggreganases, these enzymes will destroy the aggregans, and also metalloproteinases. So two enzymes responsible for degradation of cartilage, aggreganases, and matrix metalloproteinases. We call the matrix metalloproteinase MMP, the abbreviated form for them. MMP, matrix metalloproteinase. The abbreviated form for them is MMP, the matrix metalloproteinases. Responsible for the breakdown of proteins and proteoglycans and glycosidases. Wow, sir. Yes, sir. কাজ চলছে না কালকে ওটা মিউজিক দিছেন So glycosidases responsible for breakdown of glycosaminoglycans. So glycosidase, another example of enzyme which causes degradation of cartilage. So these kind of informations are important for MCQ, like true false type of questions. And so three types of enzymes responsible for degradation of cartilage: aggreganases, matrix metalloproteinases, and glycosidases. So again, there's example of some pro-inflammatory cytokines such as interleukin-1 tumor necrosis factor, which are released during inflammation, stimulate production of aggreganases and metalloproteinases, causing cartilage degradation. So during inflammation of the joint, some factors are released like interleukin-1 tumor necrosis factor, and they stimulate the production of these enzymes, aggreganases, matrix metalloproteinases, causing cartilage degradation. So this is the mechanism how cartilage is degraded in different types of arthritis. Synovial fluid. So synovial fluid is a viscous fluid. Viscous means a little bit thicker than plain water. Okay, viscous liquid that lubricates the joint. It is an ultrafiltrate of plasma. Important line: ultrafiltrate of plasma. So synovial fluid is an ultrafiltrate of plasma into which synovial cells secrete hyaluronan and proteoglycans. So those hyaluronan proteoglycans, where do they come from? They come from the synovial cells. Synovial cells are called synoviocytes. So synovial cells are called synoviocytes, and synovial cells, from these synovial cells come the hyaluronan, the proteoglycans. That means the components of the uh, matrix of articular cartilage. So intra-articular disc. So not all joints, some joints contain the intra-articular disc. These are fibrocartilaginous disc within the joint space that act as shock absorbers. Okay, the most clinically important are the menisci of the knee. In the knee joint, there are some meniscus. Those are examples of intra-articular disc. Let me show you. Knee menisci. So let's zoom this image. So these are two menisci, the medial one and the lateral one. So these are examples of intra-articular disc. Intra-articular disc. Okay. Intra-articular discs are also a avascular structure like the articular cartilages. So about the synovial membrane, joint capsule, and bursa, we studied about that in the earlier image. So the cells of the synovial cavity, these are called synovial cells or synoviocytes. Those are phagocytic cells, and they are derived from the monocyte macrophage lineage. We have learned about another multinuclear cells. Those are osteoclasts previously. And synoviocytes, type A synoviocytes, are responsible for removing particulate matter from the joint cavity. So they are like macrophages. They remove particulate matter from the joint cavity. And type B synoviocytes are fibroblast-like cells that secrete synovial fluid. So mainly the type B synoviocytes, which are fibroblast-like cells, and they secrete the synovial fluid. Most inflammatory and degenerative joint diseases are associated with thickening of the synovial membrane and infiltration by lymphocytes, polymorphs. Polymorph means neutrophils and macrophages. Hi. The next topic is about the skeletal muscle, their composition. So let's read the text first, and then I will show you the image. So skeletal muscles, they are mainly composed of some fibers, muscle fibers, which are called myofibrils or myofibrils. Individual myofibrils are organized into bundles, like they are called fasciculi. So myofibrils are some fibers. They are some fibers, and when some fibers get together and form a bundle-like structure, that bundle is called the fasciculi. So there are lots of fasciculi side by side, and that fascicula is covered by a membrane-like structure, which is called perimysium. Okay, so then the muscle as a whole, then lots of fasciculi form a muscle, and the muscle is covered by a thick layer of connective tissue, the epimysium. So the epimysium is a connective tissue covering which covers the muscle, the whole muscle, and the perimysium covers each individual fasciculi. Okay, epimysium and perimysium. Okay, so let me show you the image now. We will go back to earlier image. Here it is. So this is a skeletal muscle. When we take a transverse section of the muscle, it looks like this. So we will see that each of them are fasciculi. So each fasciculi consists of some fibers, which are called myofibril. This is shown here. Myofibril, these are fibers, myofibril or myofilament. So each fascicle is covered by perimysium, and the muscle as a whole is covered by epimysium. So you see, epimysium covers the whole muscle, and the perimysium covered the fasciculi. So next, about tendons. So tendon, let me tell you simply, if this is a muscle I'm drawing here, if this is a muscle, so muscles have origins and insertion. From one area, the muscle originates, and then to another area, it inserts. So just before insertion, some muscles have their endpoints, their terminal end, which is a strong structure, the stronger than the original muscle and a bit different than the original muscle tissue. So this terminal part is called a tendon. So tendons are insertion points of muscles. Okay, so these tendons are tough and fibrous structures that attach muscles to a point of insertion on the bone surface called the anthesis. So let's suppose this muscle inserts in this bone. So the point where this tendon is attached, the point of the bone where this tendon is attached is called anthesis. So the point of insertion of muscle tendon is called anthesis. So when the anthesis is inflamed, this is called anthesitis. This is called anthesitis. So I am explaining very slowly. So you try to understand first and then memorize. Okay. So let's write it down here. Inflammation of the anthesis is called anthesitis. You will read this term eventually during your study of the rheumatology. So this is called anthesitis. Okay, anthesitis. So what is anthesis? The point of insertion of the muscle tendon in the bone. Okay, so then let's end this lecture here. In the next lecture, we will start joint aspiration. Stay with me to learn clinical medicine first, and then we will go back in a retrograde fashion to the anatomy of our extremities, upper extremity, lower extremity. Eventually, we will learn hematology, clinical hematology, blood physiology, and then histology also. So this is an advanced invitation to you all to study with me so that you have clear conception about what is written in your textbooks. So best of luck. We will meet again, inshallah. Till then, bye.